This is Dr. Fedorchenko, addiction psychiatrist in Dallas, Texas. And today I want to talk about diagnosis of substance-related or addictive disorders. We can generally divide substance-related disorders into substance use disorders and substance-induced disorders, like intoxication, withdrawal, or substance or medication-induced mental disorders. Today, let's concentrate on substance use disorders. To help us understand what it is, let's look at DSM, Diagnostical and Statistical Manual of Mental Disorders. In its 5th revision, is the main source of diagnostic criteria for mental health-related issues in the United States. DSM-5 recognizes 10 classes of drugs that can cause some substance-related problems. These 10 classes include alcohol, caffeine, cannabis, hallucinogens, inhalants, opioids, sedative, stimulants, tobacco, and other or unknown substances. Improper and repeated use of these drugs can lead to the formation of substance-related disorders. I also want to briefly mention gambling disorder, which is a relatively new diagnosis, and it belongs to the group of conditions sometimes called behavioral addictions. Although not caused by a substance, this disorder is thought to have similar underlying pathophysiology, that is, an illness-creating process in the brain. So, what is a substance use disorder? We generally understand it as a process or a cluster of cognitive, behavioral, and physiological symptoms. These symptoms indicate that the person continues to use the substance despite significant health-related issues. The change in brain reward circuits is thought to underlie the pathophysiology of the process. One of the most notorious effects of this condition are repeated relapses and drug cravings. In order to diagnose this condition, physicians use a specific set of criteria. These criteria are grouped into 4 categories: impaired control, social impairment, risky use, and pharmacological criteria. The combination of these symptoms lead to a clinically significant syndrome that we call a substance use disorder. Some common examples include alcohol use disorder, opioid use disorder, or tobacco use disorder. So, to summarize, substance use disorder is a cluster of cognitive, behavioral, and physiological symptoms. A person continues to use substance despite significant problems related to its use. To aid in diagnosis, physicians use a specific set of criteria that are grouped into 4 categories: impaired control, social impairment, risky use, and pharmacological criteria. Thanks for watching, and see you next time.